1/3 of all human beings will experience what we're about to talk about at some point in their life. Hiking on the trail and with your buddy, he cuts his hand accidentally and passes out. What do? How dangerous is that? Did he hit his head? We're going to talk about passing out hiking, passing out on the trail, what it's called. I'm going to keep the medical terminology down to the minimum the best I can. And then we're going to talk about what you should do if you're on the trail and this occurs and how you're going to get through it. I'm Dan Williams. I'm a PA. I've been doing urgent care medicine for 44 years, and I've been hunting, fishing, hiking, camping for 50 years. So what that's called is a long name called vasovagal syncope. Syncope means passing out. Vaso is dilation, the blood vessels. Vagal is the vagus nerve that runs from the brain. Versus something that some of you may have heard of called POTS, P-O-T-S, which is postural orthostatic tachycardia. That big long name means that when you stand up, your heart beats really, really fast and you fall down. The difference between the two is that in POTS, POTS, that happens much more frequently, and you have this history of the heart racing and you pass out, pretty common in teenagers, young adults. We're going to talk today about reflexic syncope. So that is a situation where you see the sight of blood. It can happen if you actually urinate. It can happen if your ears are being irrigated, if there's emotional injury and you're really anxious and excited and the person passes out. The danger is not so much in passing out as in hitting your head and having a head injury or breaking a wrist when you fall. If this happens in the outdoors when you're on the trail, not only does it scare the hell out of everybody, but you need to be prepared and know when are you going to bring this person back in to base camp or just, X and nix out the trip. So that's what we need to address today. 1/3 of all people have a syncopal passing out episode in their lifetime. 1/3, pretty common. 5%, at least 5% of all people will have at least 5 episodes in their lifetime. So that's quite a bit. Now, what happens? So what happens is that the person sees the sight of blood. Something occurs where they're emotionally distraught and they hit the ground and they pass out. What happens is the vagus nerve basically dilates blood vessels, and what happens is your heart rate slows down as opposed to POTS where it speeds up. And so you get decreased perfusion to your brain and boom, down you go. So your blood pressure goes low and you pass out. As soon as you are in a supine, a flat position on the ground, what's going to happen is your heart rate's going to pick back up and you're going to be totally fine in those situations. All right, so here's the addendum. This is what's important. So how do you know that it's not something serious? If I get something like this that comes into the clinic, 100% of the time, it's usually a massive workup. It's a blood test, it's an EKG, it's the whole 9 yards, and or, depending on their age and comorbidity, we're sending them to the emergency department. And they need to be scanned, they need to have this massive workup. So things that can cause syncope that's not necessarily reflexic syncope are things like metabolic problems, glucose, hyperglycemia, hypoglycemia, heart illnesses, arrhythmias, any medications that you're taking that jack around with the heart, blood pressure medicines, antidepressants, anti-anxiety meds, cannabis can actually do it. Dehydration, heat stroke, heat exhaustion, like we discussed a few videos back. Seizures. A woman who doesn't know that she has an ectopic pregnancy can pass out. So here's situations that are really important to note. Now, if you have your partner and you're hiking on the trail and you're camping and this occurs and they're under 30 years old and you saw them cut themselves and they pass out, most likely you're going to be fine. However, my advice is we still don't know, because you've seen athletes on the court like, remember Hank Gathers? I was a big NCAA basketball fan. Hank Gathers, African-American guy on the court, passes out. He had cardiomyopathy. Any heart illnesses in young adults. So it would behoove you to know your hiking partner's history. If they're over 40 years old and this occurs, you need to stop the trip. You need to go back and have them worked up. Absolutely. But if you have a cause and effect, ice cold water, getting in a stream, sight of blood, then you can probably chill out a little bit. But as an asterisk and a YouTube video, I'm saying you probably should get them all checked out. I want to remind you guys here that every month we do a giveaway. And in order to get that giveaway, you got to subscribe, so obviously. And why is it important for you to subscribe? Because what we're doing is we're going to, every video, or at least 90% of the videos, we're going to teach you what to do in order to be safe in the outdoors, and if you get injured, how to take care of yourself from a variety of issues, from spider bites to snake bites to poison ivy, you name it. And then at the end of the month, we do a free giveaway, and they're pretty cool. I have to admit myself, I wouldn't mind getting it. So in a few weeks, we're going to be doing that giveaway just to keep you updated. All right, let's get back on topic. So what do you do? So your partner just passed out. You want to check their head, make sure there's no head trauma, no lacerations, lay them down in a flat position. Now, for years, there was something called a Trendelenburg position. Dr. Trendelenburg developed this where you lay flat and you have your legs up above your heart. I'm going to throw a couple articles up here and show you that lately, in the last, I would say, 5 to 10 years, that has been nixed because it really shows it doesn't do a whole lot. However, I'm still doing it in the clinic. If the individual is in their 20s or young, it's not going to hurt anything. The reason why they nixed it is when you raise the legs up, you increase some intrathoracic pressure. If someone has some heart problems, it can go haywire. So they basically have not been doing the Trendelenburg position anymore for individuals that have a vasovagal syncope. Important to note. You want to give them fluids, always fluids, right? I mean, it's not going to hurt a doggone thing. So give them fluids, lay them flat, let them come around. If they're not coming around in 2 minutes, which is a long time, you need to call 911 and get them out of there. 98% of the individuals I have seen that have this vasovagal syncope, they come back within less than 30 seconds. We had a doc one time in the clinic, the patient was getting their ears cleaned out, they had a vasovagal, the doc was inexperienced, sent the person to the emergency department, and it was just a vasovagal. Kudos to the doc because they were just trying to take care of all their bases there. So I'm just letting you know, lay them down supine, check for injuries, check their wrists and hands and fingers, check their neck, check their head, and then give them a few seconds, you know, see if you can arouse them. Ice, you're not going to have it. So in your fantasy, it would be nice to have ice. Get a cool washcloth, water, forehead, try to wake them up, have them sit up slowly. They'll want to get up right away, most likely, but do not allow that. Give them some fluids. If you're unsure and your gut tells you you're unsure, get them the hell out of there and get some transporting them back to base camp. All right, guys, I hope that helps. I hope you don't have to experience it. Maybe you already have. A third of the population has experienced this. If you have, comment down below. I would love to hear your experience, how it was taken care of, or do you have POTS? Let me know. I'll be glad to get back to all of you. Keep your eyes on the horizon, your face to the wind. Be safe.